This is a review of the Zyppah mouthpiece for SnoringMouthpieceReview.com. When it arrives, the mouthpiece comes in this box. The box contains booklets, instructions and a case which contains the Zyppah mouthpiece. The Zyppah performs two different purposes. First, it advances the lower jaw. Second, it stabilizes the tongue. This is what the Zyppah mouthpiece booklet looks like. In it, you can see an overview, care guide, how to use the Zyppah the first night, fitting instructions, tips for how to use the device, warnings, and intimacy tips. The Zyppah mouthpiece is made of a hard outer layer, soft inner layer which is used to make an impression, and an elastic band to keep the tongue in place. The Zyppah mouthpiece has an airway opening of only 3 mm, this may make it difficult to advance the tongue while wearing the device. This is a view of the Zyppah mouthpiece before making an impression. To fit the Zyppah mouthpiece, first boil water, next, pour the water into a bowl, then, immerse the Zyppah into the hot water for 45 seconds. Keep the device underwater using a utensil. Next, remove it from the hot water with a utensil by the tongue strap. Put the device on your lower teeth with your fingers and then bite down firmly for 1 minute. You should see clear, deep impressions of your teeth when you're done. Once you're done, rinse off the Zyppah under cool water for 30 seconds. This solidifies the impression of your teeth. This is a recording of a patient before using the Zyppah mouthpiece. The following are recordings from 4 nights of the patient wearing the Zyppah mouthpiece. These are oxygen saturation charts of the patient while wearing Zyppah. These show that the patient was able to get enough oxygen while sleeping. After wearing Zyppah, the patient mentioned they had jaw discomfort the first night, an inability to swallow each night and that they woke up many times while wearing the device. They mentioned the device had to be taken out many times during the night before going to sleep and that it was hard to sleep on their back. The patient mentioned they could only fall asleep on their side while wearing Zyppah and that the rubber band that kept the tongue in place was bothersome. While the patient did have reduced snoring, they found the device uncomfortable each of the 4 nights they wore it. You can clean Zyppah by using a toothbrush and toothpaste under warm water or by using Zyppah's snap cleaner. Overall, Zyppah may reduce snoring but the rubber band can make it difficult to swallow and sleep at night. Thank you for watching this review. For more Snoring Mouthpiece reviews, please visit SnoringMouthpieceReview.com.